never close the door to an opportunity. I think I actually accidentally stumbled upon my job. It was literally, I was going on, I went and applied for another position and I was like, oh, that says HLT. That's probably an acronym for health. Let me click on that. And it led me here in a great situation. And I found a position that was literally perfect for me. So I would just say, don't limit yourself and click one more time. There we go.
Welcome to the Public Health Millennial Career Stories podcast, episode number 9. Hi, my name is Omari Richens, and I'm really glad that you all are tuning in today. I get to sit down and talk with Michael Grier, MPH. He is a disability, aging, and behavioral health policy advisor at the Office of the Deputy Mayor for Health and Human Services at the Government of the District of Columbia. I really enjoyed hearing about his story to this position. Public health was his plan B, and it was really through one of his professors, Dr. Cynthia Boru, that she really pushed him to think outside of just medical sciences and being a physician to focus on health. And I think that's important for a lot of us out there to really understand that. And I think public health should be your plan A, just because we need a lot of help in public health field. One thing that really stood out to me in this interview was just the fact that representation is something that we don't really see from a lot of Black males in a lot of fields, and that was something that not really a challenge, but something that we saw during my MPH, during Michael's MPH, and in the field of public health just in general. Something else that really stood out to me was Michael said that we have to be better salesmen of our public health work, and I think that's really important because we have so many tools and so many perspectives on looking at issues, and until people really understand that and see what public health can do and we show and sell that to other people, public health is going to be a little behind. So we need to really advocate for that kind of change. And without further ado, here is today's episode. This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Today, we have a public health professional with experience in program management, health policy, state and national data collection processes, database management, and personnel development. He received his bachelor's in biology from Philander Smith College and master's of public health in the concentration of health policy and management at the University of Arkansas for medical sciences. He is currently a disability, aging, and behavioral health policy advisor at the Office of the Deputy Mayor for Health and Human Services at the Government of the District of Columbia. He is always looking for new opportunities to advance the health of all. We have Michael G.E. Grier, MPH. Welcome to the show, Michael. How are you doing?
I'm doing pretty well.
Yeah, it's great to have you. This is nice because I'm going to have 2 males back to back. 7 episodes with women and then 2 men.
Hey.
That's how it goes. Okay, so I'm just going to jump straight into this. So how are you coping during the COVID-19?
I'm actually, the COVID-19, while the pandemic has really made it difficult to do a lot of work and it's changed a lot, it's been really not that bad for me. It's allowed me to do a little bit more of what I actually like to do, which is read. So I do a lot of reading now for work, and usually my day is punctuated with a million meetings, and you're constantly flying from one situation to another. And so I've actually been able to be at home, have a Zoom meeting, open a document, get really, really deep in it, find myself at 10, 11 o'clock at night still reading, and it's like, oh, I was actually kind of just in this. So it's been good, but I've been kind of coping with work, and the behavioral health side of me says that that's not the healthiest thing to do, but I've been getting a lot of exercise as well, going out for runs and little virtual happy hours and different things to just kind of, keep the mind occupied and hanging out with my very small, close friend group as much as possible. But of course, we're 6 feet apart.
Yeah, and all those things are definitely very necessary. So, reading, do you do only reading or based on like work stuff, or do you do fun reading also?
So, one of my goals was to fun read, uh, but I find it really it's hard to fun read anymore when I read. It's like, oh, here's this 80-page piece of legislation that you have to read and dissect by tomorrow, and so it's like, I'd rather I'd rather just do something a little more mindless, i.e., watching TV, which is, I know it's really bad,
I completely understand that, though. Completely understand that. So, tell us a little bit about your personal background.
Sure. So I grew up between Brooklyn, New York, and Tulsa, Oklahoma. I consider Tulsa to be home. Go Black Wall Street. And so it's really, yeah, I feel like I've always described myself as kind of a New Yorker with a Southern twang and a little bit of a Southern spirit to me. So I like to say I have the soul of a New Yorker and the heart of a cowboy. So who's gonna stop me? And so it's, yeah. And then I found this really small school in Arkansas called Full Anderson College, and that pulled me into Arkansas. And yeah, that was it.
Okay, so
School.
so you moved from Tulsa, Oklahoma to Arkansas.
Yeah. So I was really lucky. I was, as you said, my bachelor's is in biology, so I did a summer STEM program with emphasis on mathematics and technology, of course. And so from there, I just kind of got stuck, and I found myself, yeah, I was in love.
Okay, and well, I guess where would you say your public health journey began? I'm guessing it's somewhere during your bachelor's program.
Yeah. So I was, of course, what many faithful MPHers are doing. You go to you get your bachelor's in biology, and all of a sudden you're kind of asking yourself or having these questions about how can I kind of leverage something to get into med school. And so I was listening to creating a plan B for med school. And I thought about it, and I said, public health, I think, is going to be my plan B. And I can also leverage that into getting into medical school. And so I had, I went ahead and applied to the program. I did a 4+1 program, which is kind of unique. And then I fell in love and found my niche.
Okay, so 4+1 for your MPH program.
Yeah.
So 5-year program or 5 semesters?
5 years. And so my college had launched it. I was either I think I was like the second or third person in the program. And so you do 4 years at your undergrad, and then you do 1 year full-time grad school. And so during your junior and senior year, you actually start taking courses at the grad school. And you kind of balance both of the schedules of grad school life and undergrad life. It's a little bit challenging, but it was a really good opportunity. And I was able to write some of my papers and use them for different classes. And so 1 paper, 2 classes, you gotta love that.
Yeah, double dipping never gets better than that. Okay, so just to take you back. So you did your bachelor's in biology, and what was your focus on your mind? Well, I guess med school, and why was your focus med school at this point in time?
Oh, wow, I haven't been asked that question in a while, but do you remember the movie John Q?
No.
So it's John Q is Denzel Washington. He was phenomenal. His son needed a heart transplant.
Yes. Okay.
Yeah,
Yes.
yeah. And so it was very, very awe-inspiring. And I always had this idea of being a physician. And so seeing that movie and seeing a Black father fight for his son the way he did, and I just kind of looked at what was needed from that situation, and they needed a cardiologist that was going to say, move all of the barriers, move all of the problems away, and you be that person to get the job done and find this guy, this boy a heart. And so my plan was to be that doctor. And so, yeah, that stuck with me.
Yeah, fair enough. And it's a very visual profession. It's very out there, and it's something that everyone knows, everyone sees, everyone goes to a doctor at some point in time. So there's definitely that I guess I don't know. It's kind of on a throne in a sense, medicine.
Yeah, it's. I feel that even culturally, there are some cultures that are like lawyer, doctor, engineer, and so I think that that's a lot of what we see, and we think that that is the only way that health is driven. And I think once during my time in school, during undergrad, I really realized that there are a lot more factors to health than just going to sit in front of a doctor for 15 minutes and having them ask you a litany of questions. So,
yeah, absolutely. I want to say healthcare comprises maybe 20% of someone's like health overall health. So yeah, there's a lot more that goes into that just healthcare. So
exactly.
what point in your journey doing your bachelor's with biology did you say, okay, I don't want to go to med school anymore, I want to go to do my MPH? Or was it you got into, how did you get into the 5-year MPH program? Like when during your undergrad did you have to switch into that?
So my junior year, I applied and got in, and so I did. I had to take my GRE and all of that stuff during my junior year, and I started taking classes the summer. I think it was 2010. I think it was the summer of 2010. I started taking classes, and so what really, of course, the backup plan. But one of my professors, who is phenomenal at Philander Smith, Dr. Cynthia Burrows, she is an amazing advocate for healthcare in general, and making sure that students understand that while medical school is great, there are more tracks. And so she was really a driving force behind, like, hey, think about this. And a lot of what she was saying at the time didn't really stick because I was so focused on medical school. But when I started broadening my horizons, her voice came into the back of my head and said, hey, go get that MPH.
Yeah, absolutely. And we need more people like that because, as I said earlier, like when you think of health, you think of medicine, nurses, and you don't really think of the public health side of it, where public health can really have an impact in so many different ways, people's health and lives. So why did you choose to do your MPH in health policy and management?
Oh, I don't know. I really don't know. I really don't know. I don't know when I don't think there was ever a point where I flipped a button or my mind just said like, hey, you need to do health policy. I know I love policy. I've always been a little political nut. And so, yeah, I think the one maybe light bulb moment I had was during health economics. So the ACA, of course, had just passed. And so since the ACA had just passed, my professor literally printed off the entire bill. And he comes in with this massive bill, and he literally licks his thumb and starts separating out different sections and handing it to people in class. And I loved having that experience of actually researching a piece of legislation. And I think that would probably be the light bulb moment, but I don't think it wasn't a conscious, it wasn't a conscious choice because it was really painful. I remember my responsibility for that assignment was long-term care provisions in the Affordable Care Act, which were everywhere. So I had this one section, but I had to dig through everything, and it was just, yeah. But I think that was the closest to a light bulb moment that I had.
Okay, and so it seemed like you're more interested in the policy side than the management side.
Oh, yes and no. Yes and no. I think I think that I like people and I like managing. I've done it in my career. I like to inspire my staff. I really try to figure out how to, some of my staff hate that I say this, but I always ask them what's next. Like, when are you leaving? When are you quitting? Because you need to be moving and you need to be taking steps to improve and better your career at every step no matter where you're at. And so I really love the management portion of it, and I love the direct interaction of health. And so I enjoy both equally, I would say. I think I've kind of gravitated more towards the policy side just because I feel like that's more of that's just been able to be my niche, and I've been able to kind of find my, just a little bubble of that I can really kind of thrive in. Okay. And I think another part of it is you don't see a lot of Black men in policy, particularly health policy. I was actually considering a PhD program at one point, and I reached out to someone who was at the same university doing their DRPH. And he said, well, I think you would probably be the first Black man that I would see there since 5 years that I've been here working on my PhD. And so I think I like a little bit of the fact that I'm a Black man in health policy, and that is a unique, rare thing. And I think it helps me bring a unique perspective, which drives a little bit of my passion for knowing that I'm that face in the room and that voice in the room. And if you're not at the table, you're on the table per usual. So I think I like that. I like being able to be that voice and make sure that I present that perspective.
Yeah, and that's absolutely very important, especially with the US now. Most of the policymakers and the people involved in policy are old white men, no disrespect, but that's just how it is. And that are the laws that govern the country, but it's not really representative of the country. So it is great to see more Black men take up this role. And I hope from this interview, more people get inspired to go into policy and bridge those gaps that are needed. So what do you think? Actually, you spoke about wanting to develop people and like have that management. Where do you think that leadership and that personal development skill came in? Through your MPH or afterwards?
I think that started way before. So I did leadership in middle school. I did ROTC in high school. And I think during those times, it was really ingrained in me, one, how to lead, and two, what it takes to lead, understanding what it takes to lead. And so a lot of times people think that leading is being in a specific position, and it's not. It's about what you can inspire your people to do and what you can do to make the lives of your people better. And I think that was the leadership philosophy that was instilled in me through all of what I was trained to do. So I think that's where I really get it from. And I wouldn't trade being an ROTC geek for anything, because it was a great experience.
Okay, fair enough. And I like that. I like how you want people to say, okay, what's next? Because I do agree that we always continue to have to grow, and we have to keep on putting our foot forward to make those steps in our career and get to really where we want to be and to the top of our potential. So what was your best experience in the MPH program?
My best experience. I think during an interview, silence is always a bad thing. But I'm not sure what my best experience would be. Well, I think one of the best experiences was I was in the lab working overnight. There's this little computer lab that in the College of Public Health at UAMS, and I'm sitting there. It's like 11:30, and I'm just trying to drill out a paper as much as I can. And I turned around, and I look behind me and there's somebody else like tucked off in a corner doing it. And it's a Black man, Nathan, and he was working on his DRPH at the time. And we really just had a moment to sit and really talk. And he just really inspired me to kind of keep on going and keep on moving through the kind of public health journey and stay involved at the public health, at the School of Public Health. And yeah, it was a really inspiring moment because it was kind of like you see somebody that looks like you and really understands all of the dynamics. I was the only Black person. Well, let me rephrase that. I was the only Black male in most of my classes. And if there was another Black person, it was a Black female. And so it was always kind of this dynamic of me being the voice of African Americans in talking about health disparities and what we need, and from a perspective or presenting an argument to a specific policy. And so it was good to have somebody else who understood that that role in that journey was much bigger than just me, and they really understood why I kind of stuck in there and stayed with it.
Yeah, and that's very important. And that's one reason I'm doing this too, like representation and seeing yourself in people that you want to, like people that you look up to. And I think that's very important because it's not something that has been taught and not seen a lot over the last decades. It's definitely only now becoming more common to talk about and make sure that we have representation in different ways, whether that be on TV and movies, et cetera, et cetera.
I appreciate it. It's hard to be in a program where you are the only face. It really gets hard. And so I appreciate what you're doing here and really trying to make sure that people know that you're not alone. There are more people out there that are going through that same struggle as you in trying to impact health globally or nationally or locally, but there are people that look like you that are doing it as well.
Yeah, and that's important to know. So after your MPH, which you graduated in 2013, you started working at the Arkansas Health Department as a hepatitis C coordinator. How did you get that position?
My preceptorship. So I had applied for my preceptorship. I got a random email and I was like, oh, great. This is a preceptorship that pays. And so I went and applied. Luckily, I got the position, and it turned into a job. Okay. And so it was really just a great opportunity, and it just flowed.
Okay, and did you do similar work on hepatitis C in your preceptorship, or?
Oh yeah, I literally did the exact same job.
Okay,
well, just more time.
Well, that's awesome. So what did you do in that role?
So it was a lot of data and conversations and meeting with different healthcare providers that were, particularly I was responsible for the criminal justice side. And so it's the entry-level contact tracer job. And so it was send off this report, follow up on this report, enter this report, and over and over and over and over again. And so, yeah, it was very grueling, but it was a good experience, and it was a good introduction into public health in the workplace.
Okay, that sounds like it was a great transition from your preceptorship straight into a job, and then it seemed like you switched positions in the department to WebIZ, Immunization Registry Manager.
Yeah.
Do you want to tell us what that is and what you did on it?
It's the state immunization registry.
Okay.
And so it allowed all of the various providers all around the state to go online and actually enter the vaccines, and we would track vaccines that we shipped out to various providers through the VFC program, Vaccine for Children's program, as well as the flu. Oh my God. Moving flu. If you want to do something hard in public health, figure out how to move flu vaccines every year. It is extremely challenging. getting them there on time, and then making sure they all get coded in the system. It's really, yeah. But yeah, and so I was really, really lucky that I think my boss at the time when I was a Hep C coordinator was really good about promoting me and making sure that I got exposure. And so she went and said, hey, this position is open. I think you would be good at it. And I don't know this, but I think she actually may have done a little work on the back end to help me get into that role. And so it was a really good, it was just a really good transition and a really good experience.
Okay. And that's really good to hear. And then from there, you changed it up quite a bit and you became a campaign organizer / health policy analyst. So why the change?
In all honesty, I love DC. I love DC. And I realized through working with the WebIZ program, we had to do a lot of actual policy because this was a new system that was just being rolled out. And so I really felt that policy bug and that policy itch start scratching because there were so many inconsistencies and we were trying to figure out how to stabilize and get everyone on the same page. And so it was an opportunity for me to get closer to policy. Mm-hmm. And so the thought process was, go work on the campaign, win the campaign, move to DC, work on the Hill. That middle part didn't work out so well. The middle part didn't really work out, but it was a great experience. And one thing about working on a campaign, everything is so hectic and you're always working. And so it was a good opportunity for me to have the experience of creating my own job, that's where that health policy part comes from. Mm-hmm. So we were still right in the trenches of the ACA where everything, that was 2013, 14? Yeah. I
believe so.
2014, I believe it was. Anyway, somewhere in there. It was 2014. And so we were right in the trenches and really trying to figure out, as we were starting to implement some aspects of the Affordable Care Act. And so because we were doing that, there was a lot of concern. I remember taking a call from someone who was calling to complain about the fact that Senator Pryor supported the Affordable Care Act. And she told me, people are dying in the streets. I said, I'm sorry, ma'am, what street are you driving down? Because I'm not seeing that on my street. She did hang up on me. But what that allowed me to do, I was able to go to my boss and say, hey, we don't have talking points on this. We don't really have clear anything on this. We need to get there. And so from that opportunity, they said, well, okay, if you think that's what we need, make it happen. And so that's what I started to do. And I started to actually write and do some research and present up to his actual policy team. And finally they kind of said, well, we think you may be onto something. So you come over here, you give us these ideas, we'll have these conversations, and if we like it, we'll move something around and try and make it work. Mm-hmm. And so it really was an opportunity, again, to grow and start developing a skill set that I had, but I just hadn't actually put really into real world action.
Okay, definitely. So what would you say are the biggest roles of like a campaign organizer that people don't think about?
Not being able to sleep for hours at a time. That's definitely in there. You have to learn people. I don't think people are like, oh, you're working on a campaign, so you're talking to a lot of people. I don't think people really understand how many people you're talking to. You're talking all day, every day. And so you just have to learn people, and you have to start understanding their perspective. And not only understanding it, but empathizing with it. Because people are affected by policy in so many different ways, and you'd be surprised. Sometimes you start a conversation and someone's complaining about their health insurance, but the actual problem may not be their health insurance. It may be their actual job, and the fact that their job has a horrible, negotiated a horrible plan, and they don't understand that they can go to the health insurance exchange, or it's always, people are complex. And so you have to be able to talk to people, you have to be able to understand, and you have to be able to really drill down on a problem. Mm-hmm. And I think that was one of the good things about being on the campaign, because I talked to so many people and I got so many different perspectives, and it forced me to think a lot about not just my own little bubble, but all the bubbles everywhere.
Okay. Excuse me.
And public help reminded me of the linkage between all of those bubbles as well.
Yeah, I think it's very important to empathize and be compassionate and understand people, because, as you said, policies, they're usually a lot in there, and then the impacts of them are not always, like, they are very unintentional consequences or unintentional impacts that happen that you mightn't see at first, but after a while, or after people come up and talk to you about it, you understand better.
Exactly.
Yeah, definitely. So from that role, you moved to another role as a technical assistant and data manager for CSR Incorporated. So first, what is CSR Incorporated, and then tell us about the role.
So that was in the DMV area. So consulting services and research, everything's a consultant. Yeah, and so it was an opportunity that was really like phenomenal. Again, they actually were looking for someone with my exact skill set, which I couldn't believe. They wanted somebody who had managed a call center, had managed data, as well as had a policy background, to kind of come in and really work on a national contract. And so what we did was we actually collected all of the data from the Ryan White programs all around the country,
okay,
as well as all of the US territories, to create this huge de-identified database for HIV research, and essentially validating how good the Ryan White program is doing. And so when you see those statistics that the undetectable rate for individuals that are in the Ryan White program are equal to those in private insurance, we were the ones that actually were able to get that data and collect that from all around the country. And so it was a really huge lift, but it was fun. It was really, really fun. And I was glad that I was able to take something that I started during school, which was a focus on HIV, and take that to a national level. That led me to conferences and actually getting some really good exposure nationally. Okay,
awesome. So what was your role in that? Did you do data analysis, or do you do data management, or what other roles did you do?
So data management and the collection of it. And so when we had about 2,600 providers all around the country with various systems to collect data. And so we're trying to ensure everybody follows the same rules, or is at least utilizing the same thought process in how they collect and enter their data. And then they provide it to us in a very in a concise, consistent format. And so the actual packaging of the data was pretty easy, because there was a system that did that. What we did was walking people through not only the entering it, but when you're entering the data, and understanding what's wrong with your data while you're entering it, and what policies you should be using, and what principles you need to be using in the actual collection of your data. So for instance, if you are having someone come in for a visit, there are multiple different visits that you can do. You don't want to just say that you came in and provided medical case management. Did you meet the definition of medical case management? Let's talk through your how you provide medical case management. Oh, well, you're doing medical case management with someone who just has a high school degree. Okay, that doesn't necessarily meet that definition. So let's figure out what your organizational policy needs to be so that you can actually classify this correctly and report it to us correctly. And so there was a huge integration that happened through while I was there, which is making sure the data drove funding. And so we linked two separate systems. The program terms report, which is essentially an agency saying, this is how much money we got got this year, and this is how we spent it. And then we asked for that exact data. So it was our responsibility to go back and go help providers in their systems and figure out what they needed to do to actually account for the money that they had and ensure they were coding that correctly. And so working with those policies, again, it was really, really helpful. But the challenging part is I would be dealing with the state of Ohio, and I feel like I'm droning on about this, and so I'll move on in a second. But you could be dealing with, I would have to think for like the state of Ohio would call and say, this is our problem on a state level. You tell us how to fix it. And then somebody who's running a mom and pop that has 2 employees and 37 clients would say, this is my problem. You figure out how to fix it. And so it was a constant pulling and moving back and forth. And it was a really great, challenging experience.
Okay. And thank you for sharing that. And it says that you worked at CSR for 3 years. Was this the only project you worked on?
100%.
Wow.
Yeah.
and that really does give you perspective on just how long, like, analyzing these big data groups and really understanding what it means.
Well, this actually happens annually.
Okay.
All of this data is collected every single year. It's a huge undertaking, but listen, the people at HRSA are phenomenal. And I had never worked with people who were so passionate. Everyone at HRSA was passionate, from the manager of the program to the data analyst. Everyone at HRSA was just so passionate, and their passion just overflowed through the work that they did. And it was a great place to work, even though I was a consultant, but great.
All right, that's great to hear. And then from this role, then you transitioned into the government of DC as a disability, aging, and behavioral health policy advisor. So why did you switch from consulting into government?
So one of the things about being in the ivory tower of Washington, DC, it gets kind of lonely. And so I had I wanted to feel and see the work. And so I knew I could do that in government. And so I had to get there, because I would fix a problem in Ohio and Ohio would say, thank you. And I wouldn't ever hear anything from Ohio again. They would say, you fixed it, go away. That left an empty feeling in me. So I wanted to, I wanted to feel the work. I wanted to touch the work, and I get to do that in DC.
Yeah, so it seemed like before you're just a little more abstract, and then now it's a lot more direct. Yeah, definitely. So what do you do in your role as a disability, aging, and behavioral health policy advisor?
Everything. 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 So, I had an intern with me one day, and he just followed me around all day. And he said, towards the end of the day, he said, we have sat in meetings about criminal justice reform, housing policy, a disability council meeting, and we also did a little bit of work on HIV that day. And he was like, you're touching all of these things and all of these different really big and complicated topic areas. And so when I say everything, I do mean everything, but I'll try and boil that down. My average day is it's pretty standard. I'm at a desk and I have tons of meetings. And these can be meetings internally when we're trying to plan and stand up a program, or they could be meetings for me to get a better understanding of a program, or it could be a constituent, someone calling and saying, you all's policy is X, or the legislation that I would like for you all to start pushing is Y. Or the program, I have a problem with program X as it impacts this various group. Mm-hmm. And so I hear their concern and I work on it. That could either be talking to an agency and understanding if that is their actual policy or if something needs to be changed, or it could be if someone is talking about a budgetary issue, understanding why we've allocated our budget a certain way and possibly working to see if there's a way to either bring additional dollars into the agency to solve that, or seeing if there are discussions that can be had on a longer term basis to make a change later. And so it really, it varies. I write testimony. I testify before the DC Council on the behalf of the deputy mayor for specific areas. He's of course always there. And yeah, it can really be anything. One day I looked up and I was coordinating an actual event. It's everything. It's really, really everything. And it's great.
Yeah. So you like that it's a lot of, that's everything.
Yeah. And so one of the things that I love about public health is how those connections, those little bubbles, and how that strand that rolls through them. And so being in this role, I get to touch all of those little bubbles in some way, shape, form, or fashion, and have those conversations. And conversations I never even imagined having. And so one of my responsibilities is to monitor our K2 response here in the district and help coordinate our interagency work as we respond to K2 in the district. And so it's great that I get to call together a huge group of stakeholders on behalf of the deputy mayor and have these really intense discussions about how we're distributing our resources and what we need to do and how we need to be thinking to actually decrease the substance use in the district, and also implement harm reduction practices that will ensure these people can live and actually enter into treatment long term. And so it's everything. It's all of that, and it's just really, really great to be able to have that broad of a lens.
Yeah, that's awesome. So you said that you, like, when the intern was well, firstly, how old was that intern?
He was a college senior.
Okay, and what was that experience like, having someone intern under you?
It was just a day. He was
okay.
It was just a day.
So more like shadowing.
Yeah. Okay. And so he had very specific tasks, but one of those days he just wanted to spend with me because we of course reported out like, here's what I'm going to be talking about for the next day, and he was like, I think you're going to be talking about all the fun stuff. So
okay.
Yeah, it's a little weird. I even doing this interview, it was weird for me because being a millennial, it's kind of, I feel like I'm in this space of I'm an adult. Like I have to keep reminding myself that I'm actually like a real adult. But I'm also on a career path, in a career, at a point in my career where people are starting to look to me for advice. Mm-hmm. But I also internally, I'm like, no, there are my big public health heroes out here that I'm still trying to learn from. And so it's this weird dynamic of trying to balance being the professional people look up to, and also still having your idols and your heroes that you look up to, and you're proud to kind of follow in their footsteps. Yeah. So it's weird having being at this point in my career, and it's very, very weird having even younger professionals come up to you and say, hey, how are you doing X, or let me study you or follow you.
Yeah, and I definitely think that comes back to a little bit like imposter syndrome. You're like, oh, because I remember when I was like 13, 14, people who were like 25, 26, and they're like, oh, they're adults. And like now I'm 26, I'm like, I feel no different than I felt like when I was 14, 15.
Some days I feel like I'm still in Arkansas, sitting at my desk at the health department, crunching data, but the conversations I have, and I'm arguing with on how we're spending millions of dollars, or where millions of dollars are being allocated for various things, and saying, I get why you're thinking that way, but we need to be thinking like X. I had a reality check. I was with my uncle, and he was kind of listening in on one of my conversations for work, and I hang up the phone, and he said, it's good to know that my son is just so happy moving $9 million around. And really digging down deep and understanding how you all are spending this $9 million for the Medicaid program. And I said, oh, yeah, I was just literally having a whole conversation about the spending of $9 million and how I think that we need to be allocating that on various budget lines. And so it was a bit of a reality check that, but that did kick in. It kicked in a little bit of that imposter syndrome again, because it's weird. It's weird.
Yeah, it is definitely. So you said that you were in a lot of meetings, or you are in a lot of meetings with a bunch of different topics. So when you switched into this role, did you have to learn about these topics, or did you kind of like learn on it on the job, or did you have to read like a bunch of reports, a bunch of policy reports and different things like that?
So my first day, I got about 70 emails of past reports, big pressing issues that needed to be read. And then that night, around 6 o'clock, when I thought I was about to leave, I got called in for hearing prep. Wow. So it was read all of this stuff and become an expert, and then come and sit and listen to us do hearing prep and hear about how we're going to be talking and addressing some of our issues and the concerns that council has tomorrow. So a little bit of both, a lot of bit of both. Okay. Working in politics is always, even though I'm not a political appointee or anything, I'm around politics, and public health is politics. Mm-hmm. Health policy is politics. And so I'm really, it's always, there's never enough time mm-hmm. in the day to balance it. And you have so many people that are looking to you, and so many people that are relying on you as a government official to have an opinion on something or figure out X. And so it's a lot of stay up on a late night and read and get a good understanding of something, so that you can contribute and can make life better for people. Okay, so it's a lot of on the job, but it's also, I think you have to, I do a little bit of just Googling random stuff sometimes. You'll just hear stuff in a meeting and you're like, oh my God, I don't know what that acronym is. I'm gonna let the meeting keep flowing because I understand 85% of it. And then you just go look at that acronym, and then you go into your Google hole and you come out an hour later and you're like, oh, I now understand prostitution diversion programs. What did you know?
That's awesome. So I guess what policy issue do you think, would you say you know the most, or you're most comfortable speaking about?
Oh, definitely HIV.
Yeah.
So my background in the work that I did while I was with CSR and doing the management of the data collection process for the Ryan White program exposed me to a lot with HIV, not only the actual data portion of it, but the actual legislative and policy positions mm-hmm. As it relates to HIV. And it required me to read tons and tons of things, documents that you usually don't actually read. So prime example, a lot of people I think have heard of the National HIV Strategy, but most people I don't think actually sit down and read the 70-page document. They read the executive summary. But it required me to read, that role required me to read a lot more in depth and understand all of those flowing and moving parts, so that I could also better understand what new requirements were going to be being asked of me and my department.
Okay. And what sorts of strategies do you use to try to understand those dense documents?
So I was really bad at studying in undergrad. So I usually, for the most part, I still do that same strategy of read a paragraph, summarize it. And especially when it is really dense or really annoying or boring. I will say this, it is not my favorite reading human service policy. It is not my favorite. Yeah, just really sitting down and read a paragraph, even if I understand it, writing a sentence in the margin about it and saying, here's what it actually said. And it forces you to stay focused and stay present in the document.
Okay. So you're doing most of your reading on paper, not...
Yeah. So I'm a little old school like that.
It's funny. I prefer to read on paper too, as opposed to on a screen.
So my rule is if it's over 15 pages, we got to print that out. We just got to print that out. And so when we have new regulations, so part of my job is also reading all of the regulations that come out of my agencies. Department of Health, Aging, as well as Disability Services. So you can get 150 pages worth of regulations. And I literally just have to block off the printer and I'm like, listen guys, this is all me for a little while. It just feels, to me personally, I feel more connected to paper. Mm-hmm. And it may just be the tangible aspect of it, but it makes me feel good to have that paper and then break out my red pen and write my notes in the margins.
Yeah, absolutely. Fair enough. So what would you say is the most exciting and least exciting part of your role?
Oh, most exciting. I think the most exciting thing is actually getting to see a program stand up. And so I was at one of the programs that they stood it up maybe my second week of working in my current role, but we expanded it 2 years later. And so it was great to have sat at the table and talked about like, hey, we need to add more money to the budget for security. We need to make sure that we still are meeting the regulations on securing a pharmacy that's open 24 hours a day. We need to be doing X. We need to be thinking about X. And then you're standing there and the mayor is reading a speech that you wrote. Of course, it got tweaked, but they kept in about 70% of what I wrote. And the mayor's reading your speech, and you see all of these people standing around that are going to be doing this great work that you helped plan out. And it's just like, you can't help but smile and just know that you're actually going to touch somebody's life. Worst part, I think the worst part will be some of the hours sometimes. Sometime. It was Friday night at 10:30, and I'm on the phone with my chief of staff, and we're about to hang up, and I said, I hope I don't talk to you tomorrow. And she said, what? Why? You don't want to talk to me anymore? I said, it's Saturday. And maybe we shouldn't talk on Saturday about work. And so the hours can be a bit grueling, but a lot of times I really don't mind because you're doing good. I feel like I'm doing great work, and I get to see the impact of that work, and I get to see the change in DC, and I get to, it's a lot of passion that I get to have for my job, and it really gets fueled by seeing the actual outcomes of what I'm working towards.
Yeah, and that's awesome. I'm glad that you get to see it, and that definitely drives your work. Yeah. So where do you see yourself in the future? Actually, before we go there, how on average, how many hours a week do you work?
Oh, I would say on an average week, I would say probably around 50.
Okay.
On an average week. During budget season, I think that goes, yeah.
We just leave it at that.
During budget season, that changes drastically because you're getting lots of huge documents that all need to be read and all need to have a consistent message that aligns with the mayor's vision and doesn't conflict with any of the. It can't conflict with the lawsuit. It can't conflict with any of these things. And so you have to read this document and think through like all of these different factors that are impacting an agency, and make sure that it is clear and concise as well. And so it takes a lot of time.
Fair.
Any legislative body asks lots of questions, and the DC Council is no different. They ask tons and tons of questions.
Okay, awesome. So where do you want to see yourself in the future?
So I actually talked about this a little while ago, and my goal still has not changed. I would like to one day be the Secretary of Health and Human Services, and I would really like to implement some really bold and I really want to implement some very bold strategies as it relates to STDs and sexually transmitted diseases within the nation. So one of the things that COVID is teaching has really shown right now is that if we mobilize as a nation to really respond to a specific instance, we can make a huge difference and we can save lives. And I think where my mind keeps being drawn back to is in the 80s when there was a national outcry from LGBT men as it related to HIV. And I keep asking myself, what if we took the COVID response to HIV back then? But we can't go back in time, but we could take a very bold national strategy on STDs. And I think that we could really eliminate STDs. I think we can make them very rare, if not eliminate them.
Okay, that's awesome. If you have in mind and you don't mind sharing, what would one of those major policies be?
I think, well, we know that programs work when they're incentivized, and there has to be some incentive. And so I really think that if we looked at developing a strategy that actually paid individuals to get tested, similar to what we do now for HIV, but expand that much more broadly. Talk about actually paying for the testing and then paying on the back end again for treatment, and really promoting treatment adherence on a step-down approach that will allow individuals to be supported, take time off from work, go to all of those doctor's visits to actually address the epidemic that we're facing. And I think incentivizing it more broadly to not just focus on same gender loving men or teens, but really attacking STDs all across the spectrum. And I mean, even going into nursing homes and really incentivizing it. So if you say, hey, we created this sliding fee schedule, and if you get tested for this panel of STDs, you get $400. And when we're looking right now in an era when there is a lot of economic hardship, we could utilize this as an opportunity to not only stimulate our economy, but also stimulate our health outcomes, and really think boldly and broadly about that. And so that's from a programmatic perspective. But I don't want to go too deep, and I also don't want to give away all of my ideas. Hey, they say you only get a couple in your lifetime. But then talking more broadly about our sexual education and really broadening that with a bold national vision for sexual education and talking positively about sex. And I think that will have so many improvements on some of our social issues and social dynamics that we're seeing today when we're talking about things like toxic masculinity and the repression that we see of emotion in men, because I think that's kind of a undertone there that you have to have a healthy sex life, you have to be, and that's not necessarily the case. You have to be smart about what you're smart about, and think about the ramification of your actions, and think about the dynamics of the physicality as well as the emotional aspect of being intimate with someone. And so it's a really broad thought process of mine, but that's one of my things I would really like to tackle, and I think that we could do that rather quickly and really see some very good results.
Yeah, and I think that's necessary. Just looking at it from a public health standpoint, a lot has improved since the 80s and so far, but there's still a lot of like stigma and as you said, the economic hardship of not being able to go see your doctors to really relieve in those barriers that stop people from getting treatment or getting tested and then getting their treatment subsequently. And I think that's something that we in public health don't think about enough, the economics of the health outcomes and how we can impact that or use economics to better health outcomes. And I think that's something that we have to look at and push for more. But I'm guessing it is very entrenched into the policies, but it's just not something that we talk about enough.
Yeah, and I think we have to become better salesmen of our work as public health professionals. We have to carve out our space in these policy discussions and let people know that health policy is people policy. Because I think that a lot of times people think, oh, I'm funding the health department, that's some amorphous entity over there. And they forget that what we're doing and the work that we're doing more broadly, not just at the health department, touches people in so many varying ways. And I think that that's forgotten sometimes because it's so broad. But we need to carve out in all of these subject areas and in all these spaces, we really need to carve out our niche, and we need to hold firm to that and utilize that as a springboard to make change.
Yeah, very well said. So next question. What 20% of things you do contributed to 80% of this success?
I think this is an unfair question. But 20% of, I would say, I really think that my recharging is probably what contributes to my success overall. I think just being able to recharge. A lot of people, I don't know why they say this when they meet me. They say I have good energy, but and I think that comes from me being able to set things down and really have me time, and it allows me to enter into situations and really be clear-eyed and clear of thought, and feel tired, but it's a different kind of tired, you know?
Yeah.
It's a weary warrior syndrome, not a exhausted zombie syndrome. So I think that 20% is recharging, and I think also relationship building also helps. I think that's one of the things that has allowed me to grow and go this far in my career thus far. My relationships that I've been able to form in the conversation, the connections that I I've been able to form through conversations that are sincere and open and honest. When people ask how I'm feeling, I tell them how I'm feeling, even if it's not that great. And so in doing that, I think it adds a little bit of humanity to the situation and to the topic. And so people like connecting with other humans.
Yeah, absolutely. And I love that you do need to take a break and work on your self-care. And I love that you attribute a lot of your success to just taking a break and then also networking. That's awesome. So moving on to the last section, the Furious Five. So these are the 5 questions I'm asking every guest. So question number 1, what advice would you give to a student trying to pursue a career in public health?
Find something that you're passionate about, and then find the public health in that. So public health is so broad, you can find yourself being pulled in all of these different directions, but find the topic area or what it is that makes you, that you really, really enjoy, and then find the public health in that.
Yeah, I think that makes a lot of sense. Number 2, if you were talking to someone wanting to get in your position, what advice would you give them?
I would say never. You see, I'm trying to think epically here, and it's failing. I would say never close the door to an opportunity. I think I actually accidentally stumbled upon my job. It was literally, I was going on, I went and applied for another position, and I was like, oh, that says HLT. That's probably an acronym for health. Let me click on that. And it led me here in a great situation, and I found a position that was literally perfect for me. So I would just say, don't limit yourself, and click one more time. There we go.
I like that. So number 3, what's something you are working on improving in your life right now?
I am working on improving. I would say I'm always focused on trying to improve my communication. And so I'm really focused on improving my communication and organization. While I am a fairly organized person, it's really been a challenge over the past couple of months. Just life gets busy and chaotic, but improving organization. Organization also is, I think, a good, we may add that to a part of the 20%.
Sounds good. I'll make sure to add it in. Number 4, professionally, do you recommend anything?
What do you mean professionally?
Like a book, a podcast, anything like that?
Therapy. I recommend it. You will get stressed out, and no matter where you are at. And friends are great, but it's always good to, even if it's every six months, just pop in, see a face, and have an open and honest conversation where you just have that opportunity to be free. And so I would really recommend that. But I would also recommend join a professional association or a local group. They're really helpful. The Health Policy Society of DC, I love them. They're great. And they've really expanded my mind through a lot of those tough conversations that I've been able to have at some of their events.
Yeah. Thank you for those recommendations. And last but not least, where can people connect with you?
Oh, LinkedIn.
Okay, awesome. So you can connect with Michael on LinkedIn. I will make sure to put all the show notes and all the information in the show notes for today, which will be the PH Millennial / episode 8. No, episode 9.
You're starting to get so many episodes, you're getting them all confused.
I know. They're coming in nice and slow. But anyway, Thank you, Michael, so much for being on the episode today. I really appreciate you sharing your story and your insights.
Not a problem at all.
Yes, and I look forward to chatting with you sometime soon again.
All right. Have a good one.
Yeah, same to you. Well, I'm really glad that we got to have Michael on. 2 males in a row. Isn't that amazing? Hopefully, I can keep this diversity coming and just continue to have people with different walks in life and different journeys in public health, and just really use these journeys to help you navigate your path. And there's different information. You never know what nugget of information is really going to stick with you and make you like propel your career. So I'm really glad that you joined us today. If you haven't as yet, definitely subscribe, leave a review, share this with a friend. Thank you so much for listening. You can find all the information from this episode in thephmillennial.com/episode number 9. And I'm really glad that you're here and you're listening to this episode. Have a good rest of your day. The Public Health Millennial out.